Good afternoon, everyone. Good morning. So for me, it's good afternoon, and also good evening for everyone. So I'm Abdifatah. I'm a PhD student at UCT, and I'm working on antimicrobial resistance. And I'm going to present today one of my PhD projects. And so before I go to that, I would like to. Sorry, my slide is not moving. Okay. So before I go to my project, I would like to introduce to you one of our big projects that was established in Ethiopia in 2015, which is called Jigjiga University One Health Initiative. And my project is under this big project. And this project is in collaboration with JJU, Jigjiga University, AHRI, and as well as UCT, and is funded by STC. So the major goal for this objective was to develop the capacity of JJU staff in order to make them competent to research on One Health, to develop innovative One Health interventions and policy development at national and regional level. So these are the ongoing activities that's been happening so far. So when I go back to my topic of today, so I'm working on antimicrobial resistance gene sharing between humans, animals, as well as the environment. So that's like my core title. And then within that, I have these different objectives. And today, I'm going to present one of my objectives, which is more on qualitative. So as we know, antimicrobial resistance and climate change is a global health threat nowadays. And we know that in 2050, 10 million people will die because of antimicrobial resistance unless we control. And those people will be more in Africa and Asia. And also on the other side, I have a graph which is a study which was published in 2020 and is more on antimicrobial resistance and temperature. So this was done in Europe, 26 countries of Europe. So this data was collected from 2000 to 2015, and they show that there is a association between an annual average minimum temperature and antibiotic resistance. So my today's topic is, as Karina and everyone started with antibiotic and misuse, we all know that the future of antibiotics depends on us, and how many of us understand this. So today I'm going to see how many of us understood that the antibiotic misuse can be halted or controlled by our activities. So the whole topic of today is more how many of us understand this. So we took this study we conducted in Somali region, which is the eastern part of Ethiopia, where 85% of the population are pastoralists. And this, when we were conducting, we tried to cover the health professionals as well as in the community. So we tried to also make sure that we don't miss any of the health facility settings. So we choose 4 different settings, which was the referral hospital, Karamada Hospital, which is the major city in Jigjiga, and then Gudi and Ada, they were more rural areas. So we took a Gudi hospital as well as Ada Health Center. And then finally, we went down to the community. And then, so there we used it in-depth interview and FGD, so we could understand the whole picture. So to show you what we have seen so far, is when we assessed the knowledge, more physicians and pharmacists defined antibiotics as drugs that are used for bacterial infection. But when we came to most of the nurses and most of the members of the community, they defined antibiotics as healers, as drugs that is used for viral infection or any kind of diseases. And then we asked them how do they rate the usage of antibiotics. So this one, the nurses and also health professionals, all of them, I would say, and the community, they agreed that antibiotics are used highly both in the health facility as well as in the community. While few members of nurses and few members of the community, they say they are moderately used. Then we went down and tried to figure out how they see antimicrobial resistance. So what we observed was like physicians and pharmacists, they were much aware of antimicrobial resistance, but they were more correlated with a bacterial pathogen. So, and the most common example that was given was TB. But when we went to the community and also the nurses and midwifery, other health professionals, they were not aware of, or they never heard about antimicrobial resistance. And then we asked about the stewardship program, which we use for control of antimicrobial resistance nowadays. And we observed that even physicians, including physicians, pharmacists, and I would say all of the interview, they never heard about it. And then we asked if they see this as a big problem in our area, like I would say in Somali region. So most of them, they agreed that antimicrobial resistance is a problem in the area. But when we went down a bit to the rural cities, the physicians were like disagreeing this idea. So some of them agreed that there is a problem that exists, but they can't say exactly because they don't have the capacity to test it. But in the other group, they say when they see how the patients behave, they say this could be a future problem. So this is how they think. Then the other dramatic thing was about climate change. So all of the health professionals never mentioned it about climate change. Like they never heard about it. Some few of them, they think that it's a sudden change of weather that's happening nowadays. And then, so some of the community members, this was quite interesting. So in the community, they were uncertain about climate change. So they told us that they can't measure because they don't have any equipment, and they said it's only God that can tell. But they witnessed it, they acknowledged that they have been suffering a recurrence of drought for the last 80 years. And they told us they used to name the droughts before, but now they can't because it's happening regularly. So it became a more regular. In previous years, it was being taken for a long period of time. And those pictures that you can see now is the current pictures that was taken 5 days ago. And now this year also, they are suffering a drought. So what happened was, so what we observed is most of the people who stays in the city, as like in Gode as well as in Jigjiga, all the health professionals who stayed there, they were not unaware of it. But though those who are suffering the impact of climate change, they were more aware of it. So we found the rural community more knowledgeable than the others. Then finally, then literally we try to see what are the major determinants of antimicrobial resistance. And this one we like to see about the attitude and the practice. So here I would like to mention climate change was one of the few health professionals mentioned climate change in 2 ways. So the first point was they mentioned it that, and especially this was very specific to rural areas where the temperature is too high. So they don't have that air conditioner or fans that could keep the temperature at room temperature well. So they mentioned that hot weather may affect the potency of the drugs or antimicrobials. And they gave me a scenario which that happened during that times. And it was, so there was a patient that was treated in Gode, and it was treated with ceftriaxone, and the patient didn't respond. So that patient was taken to Addis, and the patient was diagnosed with the same disease, and it was given ceftriaxone, the same treatment, and the patient did respond when he went to Addis. So they thought was that maybe the drugs they have in the hospital may be affected by the temperature. The other thing they mentioned was about the drought and the rainy season. So during these times, there is a high number increase of infection rate in the hospital. So the number of patients increases. So they said by this, there may be inappropriate use or misuse of antibiotics will increase. This would lead to, and self-medication practice also will increase, and this might lead to antimicrobial resistance. Then the other point was self-medication practice, which all the community and health professionals, they agreed on this point that all of them, they practice this. So in other ways. So we asked them what were the major reasons. So they said the easy accessibility, inpatient. When we say inpatient, there's a lot of things that's going on here. So it would be the cost when they, it could be the time, because when they go there, they don't want to use more time. And then when we go for limited of choices, so the limited of choice was a big problem because they think that even if they go to the hospital or if they go to the pharmacy, they will receive the same medication. So they don't need to go to hospital and spend more money. They rather go to pharmacy and pick it up. And why do they need to waste more time? And then the last one was afraid of being told another disease. This was more common in the city, not in the rural area. So people don't go to the hospital because they're afraid they will be told they will have another disease. And then the other one was patient behavior. Some of the patients, they don't feel they are treated if they don't get antibiotics. The preference, so in the community level, they told us they really prefer in the health center, but even if they go, the health centers don't have a lab test. So what they do is an empirical treatment, which doesn't make any difference if they go to the health center or if they go to the hospital. Because if they go to the hospital and if they go to the health center, it's the same person that they are going to meet. So the limitation of health professionals they face, and also the limitations they have in the health center, because there is no laboratory test, especially the places that we took the FGD, there was no lab centers that was established in most of them. And then sharing drugs, they all agree they do share drugs, and then the hygiene and inappropriate use. So there are suggested ways. So health education and improving the diagnosis of health hospitals or health facility, both the community and also the health professionals, they agreed with this. And then the other point that the health professional mentioned was the legal restriction on antibiotics, because it's easily accessible. They can be bought everywhere. And then finally was program implementation, like a stewardship program. And then they said research could help us, because if we know the epidemiological data of antimicrobial resistance genes circulating in that area, then it could be easy for them to use or to choose the best antibiotics. So now I'm going out of the for more qualitative, I will go to my future project, which I will be working with Pascal. And this is unpublished data. So as I've already mentioned in my when I started my talk, I'm working also on antimicrobial resistance genes sharing between humans, animals, and the environment. So which we have already collected all the samples, and hopefully we are going to analyze all the samples this year. So in that samples, we have stool samples from human. So we are trying to look it up, the antimicrobial resistance carriage with the microbiota composition. So that would be one of projects that I will work with Pascal. But this one is a data that was collected in 2016. And then we tried to look to see the microbial composition in different countries that was published before. So we tried to compare the Central African Republic and Madagascar and Ethiopia. So as you can see here, the CRR and Madagascar have a similar microbiota composition compared to Ethiopia. So Ethiopia is largely different from other countries. Finally, in summary, what we have seen was that overall interview, we have observed that there was a poor knowledge of antimicrobial resistance and climate change. And the informants were perceiving that the behavioral and social environment are the ones who are contributing to the irrational antimicrobial use and self-treatment. And few health professionals and community agreed there is a possible relationship between climate change and antimicrobial resistance. And most of them suggested that we can only halt or control antimicrobial resistance with a multidisciplinary way. So thank you for your attention. If you have any question, you're welcome.
Thank you very much, Abdi, for this wonderful presentation. And the floor is open for questions and then suggestions or comments. So please let the questions come, and then we can proceed from there. Right, Abdi, before maybe the others join, maybe my first question would be that, so you think that the antibiotic resistance, of course, challenge to the climatic impact, varies from one country to the other. What do you think could be impacting this? Is it that people in different countries, of course, in African setup, the use of antibiotics might be different from the other? I'm thinking that particularly they might be all the same, but do you think there are some things which account for differences, as you indicated in your communication?
So it was like, it's not about, it's the people is now we're looking about the people's perception. How do they really understand the climate change and antimicrobial resistance. So the difference I mentioned it was how do they see the climate change and antimicrobial resistance, because most of them, they don't aware of it. But if I really come to your question, which is saying that if I think there's a difference between countries. So in this, we really need a concrete data, which we don't have currently, to assess and see if there are differences between countries on impact of antimicrobial resistance. But I do believe that climate change has an impact on antimicrobial resistance. That I do believe. And I don't think, so maybe in countries, yeah, so because we know the policies and legals and the administration and the setup they have in different countries may contribute to the climate change as well as antimicrobial use. So that could differentiate. For example, if I talk about in Ethiopia, we know, I'm aware of that antibiotic misuse is high. And then we have this recurrence of droughts and having this kind of oil problems. And then this could also increase or double the use of the misuse of antibiotics. So this could differentiate, but I will not say there would be a big difference with the countries. Like I would say for developing countries, I think they would have much similarities.
Sure, thank you very much. And then what do you think? You think we need to do more education so that people can get to know, particularly when they get to the health workers and some farmers, for them to be able to understand how climate change impact antibiotic use, antibiotic resistance in the population? What's your take on that?
So this one is more into, so this one I will give to, so the health education that we will provide will depend on the different levels and different sectors. So we'll need more communications. And then when we come to climate change and antimicrobial resistance, so the core point is this. I would say most of the developing countries, they don't have like accurate data of climate change. So, people do believe of data. So I'm just telling them there is a recurrence, like this is what we have seen. So for example, now, the point I wanted to mention was this: if we could have a data, then those health professionals who are living in the city would have been aware of climate change. But what we have observed was that those illiterate people who live it in the community were more aware of than them, because those people were affected by the climate change. But those ones who live in the city, they have their van, they can control the temperature and whatever, the drought, because they are not more. So their livelihood doesn't depend on pastoralists. So those people, they lose their livelihood when there is a drought or something.
Right.
But these people, they don't. So in order to do that, we need to do a clear data collection, have accurate data, then convince the countries like higher level that there is a climate change that's been happening all these years. But in Africa, I don't think we do have that data now.
Sure. Thank you for that, Abdi. There's a last question before we move to the next presenter. Somebody wants to know, James Osemensa. James want to know, do the rural people associate the droughts and other changes to the climate due to human activity or just to natural phenomena? So he wants to know whether the rural folks associate droughts and other changes to climate due to human activity or just natural phenomena. If you can share just a thought in a second or two, that would be great.
So the thought was like more for them, like this was for a natural that's happening, because I already mentioned it, they were uncertain of climate change. So they told us they can't measure, they don't do anything. It's only God who can measure climate change. But what they thought was like, this is happening in a natural way, but they think that this is abnormal. This is not what they used to live. This was not the way they live. So the wind, the drought, the rainy, and everything has changed so far. That's what they told us since the last year. So they have been impacted by this climate change. So they more think is a natural thing.
Right. Thank you very much, Abdi. Please keep your questions coming. I'm sure Abdi will take the opportunity to address them as time goes on.